Thank you. Ruth Maguire to be followed by Annie Wells. Ruth Maguire.
Thank you, Presiding Officer, for the Health Secretary. Cabinet Secretary, I think some of the most difficult aspects around this are around the sort of emotional side of it. I hear from constituents who are worried about loneliness and isolation, who have relatives in care homes or shielding. Now, earlier in the week, there was an estimate from EPI Forecasts Unit in the London School of Hygiene and Tropical Medicine that the R rate in the UK was actually 1.1. So there's two things I'd like to hear. Firstly, I suppose reassurance that when we are in a place that we're able to alter or ease restrictions, that our older population and people who are labelled as vulnerable will be at the centre of these decisions. They'll be taken into account. But also, importantly, why the R rate needs to be well below 1 for us to do that. What's so important about that?
Cabinet Secretary.
So the R rate is essentially the rate of transmission, and it's about if I had the virus, if the R rate was at 3, then I would infect 3 people. Those 3 people would then infect another 3 people, and so on. It goes exponentially. The estimate broadly is at the start of the pandemic, our R rate here in Scotland was above 3. There's some debate about how far above 3 it was, but it was certainly above 3. So therefore, if you can bring the R rate down, and the lockdown measures have significantly reduced that number, because the vast majority of the people in Scotland have followed all the instructions and the advice that we have given them about staying at home, about keeping that physical distance of 2 metres, about not mixing households and only going out for those essential purposes, as well as the criticality of good hand hygiene and good respiratory hygiene. The number has come down, and the estimate is that it is below 1. It may be 0.7, but it is certainly not lower than 0.7. So the more you can suppress the transmission rate, the reproduction rate, if you like, of the virus, then the greater room you give yourself to ease measures, which may see a slight increase in the R number, but the health service can still cope, and we use test, trace and isolate to capture those outbreaks and suppress it again. So the job in all of this is to, if you like, capture where the virus is and break all the transmission routes. It's been described as making sure there are no bridges for transmission between one person and another. So that's why the R number needs to be lower than it currently is, and why we need to see some more days and weeks worth of data to assure us that we are persistently seeing a downward trend in case numbers, in ICU numbers, and importantly in the numbers of deaths. This week was the first week where we saw a reduction in the number of deaths. That will always be the last figure to be reduced. So you could see case numbers come down, ICU numbers come down, but the last one, if you like, in time terms, to come down will be the death rate. Now, I absolutely understand that for those who are in the highest risk that we have asked to isolate and described as shielding, that is a very, very hard ask that we are making of those individuals indeed. But it is there because they are at the most serious clinical risk if they contract the virus, and therefore at the most serious risk of death if they contract the virus. The other group, those who are over 70, those who currently are eligible for the flu jab and so on, also face a risk, but not as great as those who are in the shielding group. For all of those individuals, what we're asking them to do is very hard. And of course, mental well-being, loneliness, isolation will compound that situation for them. The Minister for Mental Health has made a series of important steps to ensure that the digital tools are there for people to help them with their mental health and well-being. invested in order to make sure that happens, invested in particular areas to make sure that telephone helplines are manned for longer and that the support is there for people. And today I was able to also announce an additional 5 million to assist those individuals who do not either have the equipment or the confidence or the knowledge to use those digital platforms. And we think that will assist a significant number of people across the country. They will be given an iPad or a tablet. They will be given a digital buddy, if you like, to help them. They'll be given training so that they can access all that support as well. And as we consider what options we might take to ease the lockdown measures, then those two groups of people will be very much in our front of our consideration about what we might do that makes matters a bit easier for them.